Can you be a cystic fibrosis carrier without symptoms? Imagine carrying a tiny genetic change that could affect your children but might not cause you any noticeable health issues. That's what being a cystic fibrosis carrier is all about. People with cystic fibrosis have two faulty copies of the CFTR gene, which affects how salt and water move in and out of cells. But carriers have only one mutated gene and one normal gene. Because of this, most carriers do not show symptoms of cystic fibrosis. Their bodies usually produce enough functional CFTR protein to keep their lungs and digestive system working normally. However, some carriers might experience mild or limited symptoms. For example, they could have issues like sinus infections, bronchitis, or pancreatitis, but these are much less severe than what someone with cystic fibrosis experiences. In fact, some male carriers might have infertility problems due to a condition called congenital bilateral absence of the vas deferens, which affects sperm transport but does not cause full cystic fibrosis. Most importantly, being a carrier means you do not have the disease itself. You can pass the mutated CFTR gene to your children. If both parents are carriers, there is a 1 in 4 chance with each pregnancy that their child will inherit two faulty copies and develop cystic fibrosis. That's why genetic testing and counseling are so important, especially if you have a family history of the condition or are planning to have children. Understanding carrier status is key in cystic fibrosis genetics because it follows an autosomal recessive pattern. This means a person needs to inherit two defective copies of the gene to have the disease. Carriers only have one, so they usually do not show symptoms but still carry the potential to pass the gene on. Most carriers are unaware of their status unless they undergo genetic testing, which can be done through a blood test or saliva sample. In summary, yes, you can be a cystic fibrosis carrier without symptoms. While most carriers are healthy and symptom-free, some may experience mild issues related to the CFTR gene. It's important to remember that being a carrier does not mean you have cystic fibrosis, but it does mean you could pass the gene to your children. If you're concerned about your carrier status, talking to a healthcare professional or genetic counselor can provide personalized guidance and help you understand your risks. Always seek expert advice for medical questions and family planning.